One more. I'm trying to be clean. 1, 2.
I got to laugh for miles, 'cause I got hope and smiles.
Hello. How are you doing? Welcome back to Juxtaposition. This is our talk about healthcare, part 2 with Marianna Everson. Yes. And right now we are going to talk about whole Washington. And Marianna, you know what? Doesn't Washington State already have a public option? Like, we are supposedly the first state in our union to actually are studying it or offering it. Don't we already have a public option?
So last session, this year, the beginning part of the year, they ended the session and they had passed this thing called Cascade Care.
Okay.
And what it is okay. Well, first of all, let's talk about what a public option is. So a public option is like a nonprofit, state-funded healthcare system that people can opt into. Like, instead of getting this, and it competes with for-profit insurance. So it could help. It could help regulate the price of public or of privately owned insurance companies a little bit, if it's, competing, if it's giving the same thing or better for less, right? Well, what Cascade Care is legislation to study the possible mechanisms for what that would look like, right? It's not actually the thing; it's the study of the thing, and it's to study what could be a system that could be created eventually. But what it would do would be to give our public dollars, our public tax dollars, to the for-profit insurance companies to cover more people or cover people for less. So people who now buy, like small business owners especially, or people who work for a small business, they buy into the exchange, right? The Affordable Care Act made this healthcare exchange so that people could go into this website and they could choose which plan would work for them, and how much they could afford to pay and what their deductible should be and all of that. Well, this would be just another thing on that exchange but not another thing on that exchange, but something that makes some of those things cheaper.
I see.
So it's would cap insurance premiums at 10% of somebody's income. Okay, so people wouldn't have to pay more than 10%. It's okay. It's incremental, and it's not a public option. A public option is another kind of, remember when we had basic health in Washington?
Yes.
That was almost a public option. Basic.
Oh, that's what I thought. So that's why I'm confused. Like, what are we doing?
Cascade Care is not basic health. Yeah. No, it's just a study to see how they could spend Medicaid dollars to reduce the price for people who buy their insurance off the exchange. So it doesn't help people who have employer-sponsored health care. It doesn't help people on Medicare. It doesn't help people who are already on Medicaid or TRICARE or the VA or any other thing. Just people who buy their insurance off the exchange. Good. I want to help those people. That I hope we can help those people, but I don't think this is the best way to help people save money and get better care.
So what is the best way? Tell us about whole Washington. And while you do that, I'm going to go ahead and share the screen with our audience so that they can see the website.
Okay, cool. So whole Washington is a bunch of volunteers who got together with the idea that healthcare is a human right and that we could cover everybody for less. So the first thing that we did was to fundraise to get the money to get the study done, the funding study, because everybody's always like, well, how are you going to pay for that? Well, we did that first. Okay, we got Dr. Gerald Friedman. He's a world-renowned economist, worked with a lot of different places to study healthcare and how to pay for it. And we got that passed, or that study done, and it shows that 98% of Washingtonians can pay less and get more coverage. So where should we go from there? Because there's a lot to go with that.
Why do you like whole Washington?
I like whole Washington because it covers everyone. Everyone. Every single resident of Washington State could have health care coverage that covers in the hospital, outside the hospital, your private doctor, your physical therapy, ambulance services, dental services, vision, mental health, drug treatment, all the essential health benefits that we have identified as things that everyone needs. And so by using the system that would eventually be a single payer system, but covers everyone who's not already covered by Medicaid, Medicare, and we could because those require federal waivers, and with the administration that we have right now, we're not going to get waivers for Medicare and Medicaid, so we can cover everyone else for less than they're paying now, and have healthcare be a human right, so that doctors, nurses, hospitals can just give the care that people need, and people will not be going bankrupt because of their healthcare costs. Right. No out-of-pocket costs at the point of service. So you go to the doctor, you have to pay a $50 copay, $20 copay. When you can pick up your prescriptions, you have to pay, a copay. That none of that would be happening, except for if you're with the prescription drugs. If you're getting the name brand, you have to pay a small copay, but no more than $200 a year. So if you're paying $200 a month now, $200 a year is quite a lot of savings. And that's just to encourage people to use the generic rather than the name brand.
Right. Well, this is awesome. How is this going to be funded?
So the full study is on the website. What it is a combination of, let me pull it up just so that I make sure I get the
Yeah, do you want to share your screen?
No, that's okay. Let me make sure that I pull up Dr. Freeman's study here. Okay. What it is a combination of a payroll tax, a capital gains tax, and a small premium from the individual. So how are you going to pay for it? We pay for it. We all already pay for it. We're already paying for it now. This would just be, we put it all together in one pot and pay for everybody at the same time. And like I said, 98% of people would save money. I would save like thousands of dollars a year.
Right.
Okay.
And what about business owners? Would they also save from this? Would they benefit from this plan and financial savings?
Absolutely. So most employers are paying about 18% payroll tax right now to cover health insurance, and it would go down to like 8%.
Wow.
That's a lot of savings.
That is a lot of savings.
Yeah. And then they don't have to go through all that trouble of trying to make sure they have every year they have to re-up their insurance, premium or insurance contract. And so then they wouldn't have to do that. They just be covered every year?
Wow, so that would save a lot of time.
Accused, it says, I'm self-employed with no employees. Do I pay the payroll tax? And the answer is no. The Health Security Assessment Tax payroll would not apply to sole proprietors earning from self-employment. However, sole proprietors will owe an annual personal health assessment of 2% of net earnings from self-employment. So all they're paying is 2% of their profit.
Wow.
Net earnings. Their profit, not what they, but their profit.
Yeah, not like the gross revenue. Yeah, just
so you're the financial person. That's your area, but 2% sounds like not very much.
No, it sounds like a significant cost savings.
Yes, absolutely.
Earlier in our conversation, you were also talking about, whole Washington being good in terms of protecting workers. And you had a good example of GM.
Absolutely.
Do you want to say a little bit about that?
Sure. So there's a lot of benefit to removing your health insurance from the connection to your job. Okay,
Right.
we're all like used to that. We think that's just the way it's supposed to be, that you get your health insurance through your job.
Yeah.
Well, a few things are wrong with that, and one thing that's even a bigger, more encompassing reason is because if it weren't connected to your job, you can have whatever job you want. You don't get stuck in the job that you don't like just because you have good health insurance for your family. So, but the other thing is, a really good example of this is that United Auto Workers Union right now is on strike. They had been negotiating with GM for over 18 months trying to get a good contract. And it's come down to a strike. GM canceled all of their health insurance. Everybody, 65,000 people who are on strike right now have no health insurance.
That's frightening.
I feel like that they weaponized health insurance. They took from them something that they need to stay healthy and for some people to stay alive.
Right.
Because they're trying to negotiate for better benefits.
Yeah.
So actually, they're trying to negotiate for what is theirs. But what they're negotiating, I know this is an aside, but what they're negotiating for is the employees from GM took a hit when GM was going to go bankrupt. Remember in the country, the government bailed GM out?
Right, back in 2007, 2008.
Right. The employees didn't get raises all that time because we're in big trouble.
Right.
So they didn't get raises or increases in their benefits in any way. They didn't get any part of that profit. And now GM's making record profits, and the employees just want their fair share of that. They're the ones doing the work, So anyway, they are trying to negotiate a fair contract, and GM took their health care away. So what if they didn't have to do that? What if they never were in that position? What if healthcare were a separate entity than your job, and your employer could not control you by either covering your healthcare or not?
Well, it's also
that would be freedom to me. That would be freedom.
It would be freedom,
Right?
and actually it'd be freedom for the employer as well. Because I think GM probably their thinking might be like, well, if they're on strike and they're not working, then let's save money by not having to pay their healthcare expenses during the strike. So that's probably what they're thinking is if we're just looking at it purely from a business perspective, not one of morality, right? But if the nation or in this instance Michigan had universal health care, then the employer wouldn't have to worry about that expense.
Right.
Exactly.
And also both the employer and the employee could negotiate a contract that doesn't have anything to do with healthcare, right? They could negotiate wages and time off and retirement and, gym memberships, whatever, they could negotiate aside from healthcare, because healthcare is a huge part of the negotiation process. Everybody needs that. And so the employee is trying to get as much coverage as possible, and the employer is trying to keep their costs down, right? So if we just take that out of the equation, they could negotiate on other things and have even stronger contracts, Yeah. And less conflict.
This leads me to my other question about Whole Washington. Does Whole Washington have any opposition?
Oh, we're going to be opposed by everybody and their dog. Everybody who's got a profit to be made out of healthcare, right? Everybody. Right. Insurance, pharmaceuticals, even hospitals. I'm sorry to say, like, administrators at hospitals are not for this. But the one that breaks my heart the most is our representation, right? This Whole Washington was an initiative, right, at first. And then we with the help of Marilyn Chase and Hasagawa, we made this into a bill for the state legislature, right? SB 5222 in the Senate. Okay. The head of the healthcare group in the state legislature she wouldn't even bring it to a hearing.
Wow.
She wanted Cascade Care to pass because politically that looked better to her, right?
Mm-hmm.
And the governor was behind Cascade Care, and she takes hundreds of thousands of dollars from the healthcare industry, the pharmaceutical industry, the health insurance industry.
Mm-hmm.
So I think that had something to do with it as well. So, and she's a Democrat. We're a Democrat-led state legislature,
Mm-hmm.
and they wouldn't even consider our bill, and that makes me really sad. Really sad. The reputation is that Democrats care about your health care, and this was an example of when they didn't, and that's really sad to me. Really sad. Makes me angry.
Well, do you think it's because also the Cascade Care was being considered?
Oh, absolutely.
Mm-hmm.
Yeah. So, Governor Inslee was going to run for president. He wanted to be able to say he did something for healthcare. Mm-hmm. This was something they could get passed easily and fast and without too much opposition from insurance companies, pharmaceuticals, because it's going to be profit of insurance companies, not take anything away, right? Like we explained before. And so he wanted to be able to say that he could, this is my opinion, personal opinion. Governor Inslee wanted to be able to say he cares about healthcare. He did a public option, but it's not really a public option. So yes, unfortunately, it was a political, maneuver rather than actually giving a shit about people in Washington who don't have any healthcare. 500,000 people in Washington State don't have any coverage at all.
Wow, that is a significant population of people.
A lot. A lot.
So it looks like we're almost out of time here, but I want to go and look at the roadmap for whole Washington here.
Absolutely.
So yeah, before it's initiative going to the legislature, it says.
Yes. So in 2020, we're going to take an initiative to the legislature. So what that does is, before it was initiative to the people, we only get like 3 months to gather signatures, right? This is a longer time period, and what it does is it gives, we gather enough signatures, which is like our goal is going to be 300,000 signatures. Mm-hmm. And the legislature can do those 3 things there. They can either pass it as it is, edit it and put a competing measure on the ballot where the whole Washington is on there and the edited version,
right?
Or just put the initiative on the ballot.
Okay.
So what this does is gives the power to the people of Washington to say we want this or we don't. Right. And not have to rely on people who take money from the healthcare industry to make it happen.
Right.
And we're going to be opposed. We understand that. Some people, I'm sure I'll be personally attacked. I don't care. I want people to be covered.
Yeah.
And I want people to have the best healthcare that they can get. So go ahead on, do it.
Yeah, well, yeah, absolutely. It's good for the economy in the long term, and from as a business person, a socialpreneur, I always think about the greater public policy and how it impacts economies, especially small economies and small people, small businesses like myself. And and for me, it's like, if we have universal healthcare in Washington State, I think that'll help people to be able to just soar, especially small businesses.
Yeah, think about this.
So it is.
People are stuck working in a job that they don't like, but they have this idea for a really cool business or a really cool thing that they want to do. They're stuck in this job because they have to get the health insurance for their families, and so they would be free to go do the thing that they always wanted to do.
That's freedom. That's freedom.
Yeah, freedom.
I like this, where we are now and what we must do. So, campaign efforts, fundraising, of course, ground game. They're setting up field operations. They're looking for volunteers. They're looking for people to do outreach. They're looking for people to, do the social media. And it looks like they're also having the legislative efforts, like you were mentioning, getting support for the bill. For
Absolutely.
SB. Yes.
What you can do is educate yourself on the bill. So go to thewholewashington.org and read all the things that interest you or that you have questions about. Read the funding study. Felicia, would you mind trying to click on the to show people the savings estimator?
Oh yeah. Whoops. What did I do? Sorry.
So you can go on there and put in your actual numbers of what you make and how much you pay. You can go in there and find out what your business would save, what your household would save.
This is cool.
Yeah, isn't that cool? And anyway, please go to the website and look at it up. And then when you feel inspired, because I believe you will, please sign up to volunteer. And you can find us on Facebook, Whole Washington Volunteers, and Whole Washington on Facebook, on Twitter, and volunteer. And what we're asking people specifically to do is talk to your representatives, if you're so moved to do so, and sign up and pledge to gather signatures when the time comes. So when 2020 gets here and we file that initiative, we're going to need all hands on deck gathering signatures. And I'm telling you, it is easy. It is easy. You just say universal health care and people say, let me sign that.
Yeah.
Sign. We've had people like set the board up in the window inside the restaurant and sit down, and people come inside and come to your table and say, what is that? Can I sign up? People want this and need this. So it's easy to gather signatures. And here in Grace Harbor, you can talk to me about it all day, every day. I'm on Facebook, Marianna Everson, Twitter, nursemana, and
nursemana.
I'll help in any way that I can to educate, to make, maybe we can organize some events, all kinds of stuff. And I'll be in Ocean Shores,
October 26th.
Ocean Shores Indivisible on what day? The 26th at 2:00. So that'll be cool. At the Senior Center there in Ocean Shores. We'll be talking about this.
Oh my gosh, this is so cool. And of course, we're going to have Marianna Everson back on because we are not done. We're never done talking about healthcare. And as we were talking about, if you caught our first part of this conversation, we still need to talk about opioids and pharmaceutical companies and some of the innovations that are also happening in the healthcare field. So we will continue to have Marianna on to keep us abreast on what's going on and why we should care.
That's right. Thank you.
Especially for Grace Harbor and other locales like us. Okay, let me get back to where I was before. I love to share screen, but I gotta become more finessed at it. I think I just exit out of here. There we go. There I am. Well, thank you so much, Marianna, and I hope that this conversation was beneficial to everyone. As Marianna said, reach out to her, reach out to Whole Washington. You saw the website, wholewashington.org, and it's your life, it's your health. It's and not only that, it's your community. When all of us are healthy, we have healthy communities, and when we're healthy, we prosper. Why? Because health is wealth.
Human right.
Amen. Thank you again for tuning in to Juxtaposition. We will see you soon on YouTube and Facebook. Take care and God bless.